That's a fun part of your podcast. I always enjoy it. I always enjoy your podcast.
Oh, thank you, sir. I appreciate you coming on. Everybody, we have Dr. Prisk on the show today.
Cheers.
Welcome back. We haven't done a podcast in a minute. I'm excited because you brought gifts, you brought toys, you brought all kind of stuff. And I just posted a video on YouTube yesterday about why I quit taking steroids, which you were a massive part of that. I appreciate you. You have been nothing but good to me. And everybody who has went and saw Dr. Prisk, they have nothing but great things to say after they see you.
I have to say it's been my honor and pleasure to be a part of your recovery, your just the process, and what you've done for my practice. Actually, this podcast has been great. Thank you, everybody, for coming out and seeing me. And
whenever they fucked up something, whether it's their endocrine system, break an ankle, a shoulder, a tear, they've seen you for everything, I think.
Compared to even some of the primary care physicians that I see and that send me a ton of patients, you're getting close to referring more patients than some of the guys I've known for years.
Well, so it's tough to. The biggest question I get from people is finding a good person, a good motherfucker to go see whenever they do dumb shit, whenever they have problems. Because at the end of the day, I'm not a doctor, and most people aren't doctors, nor do they have time to think about the things that you think about all day. Yeah. So, but whenever they go somewhere, they're easily taken advantage of.
Yeah, or they, my biggest thing that I've seen is the exact same thing that you said the first time I was on the show, was that there was no judgment, right? The no judgment thing.
Yeah.
Because a guy just said this to me. Was it yesterday or Wednesday? This guy said to me, I was so scared to come.
Terrified.
So scared to come because I thought you'd just be like this doctor I saw close to home who was just judgmental about, I've been using steroids for years and I just want to come off. I'm 48 years old and I want to just be better, and be healthier and not have to worry about my tendons, not have to worry about my heart, not have to worry about all these things. And I just want to do it right. I don't think I'm going to be able to recover, and I want to see how to do hormone replacement therapy. And I said, well, we could try. I've had people recover, you know, after even long term.
For sure.
So there's no reason why we can't try that if you don't want to do injections or all that.
Yeah, you want a full recovery back to somewhat normalcy, which is difficult, but possible to some degree.
Getting people on the right track is like, for their health.
It is the most difficult thing I've done personally because of the years of what it was my identity. So I had to change that, and it took a lot of mental stability and I completely forgot, because every time I see you or have to call you for something, no judgment's coming my way. I completely forgot that I stated that a year ago because I was terrified to go to the doctor. And now I'm like, no, everything's going to be okay. You have good people to take care of you.
Yeah. Well, I have to say that one of the things that's crazy interesting to watch with you right now is that identity crisis kind of thing.
It's big.
Because when I was a bodybuilder, man. Everybody knew me as the bodybuilder, right?
What the fuck am I saying?
When I was 50 pounds heavier than I am now, people would be like, "Wow!" Everywhere you go, they ask you, "Well, what do you eat? What do you do? Do you take roids? What's your training like? Like, what supplements do you use and things?" I'd walk into a gym and I couldn't get a workout in because people would be walking up to me going, "Well, what do you do to do this and this and that?" And people in the area knew I was a competitor and all that, but it would be random people. I'd be traveling in some place and they'd be like, "Dude, look at your arms." Like, how do you get that?
Yeah.
And to lose that, actually,
little tough. The
attention.
Yep.
We all kind of feed on that a little bit,
and that's
in bodybuilding.
Well, that's why I started doing it.
Yeah.
I was getting negative attention for not being in shape, for being chubby. That was the whole origination of, like, when I was 13 years old, I wanted to be jacked. I wanted to look cool. I wanted to feel confident.
Be a superhero.
Fucking right, dude. Yeah. And it started there, and then all you craved was attention. That all those memes about, like, you think you're gonna get jacked and like it's gonna be a bunch of chicks all over you, and they're like, yes, and it turns out it's just a bunch of dudes going, bruh. Your shoulders are round
as
fuck. You're
a chick magnet. You're a bunch dick of dudes magnet. It's funny. That's true. I did it because I was scrawny. Like when I started doing gymnastics when I was in high school. It was really because I was getting beat up all the time. I was skinny and small, and I would watch like I think I saw the movie American Anthem, and is that what it was? American Anthem, with the gymnasts or whatever, and there was like a guy, Mitch Gaylord was looking all jacked and all this stuff, and whatever else, and there was some hot chicks on there too, and I'm like, oh, wait a second, I want to get jacked and I want to hang out with hot chicks, so gymnastics, right?
Yeah.
So and then I fell in love with it. Well, I walked in the gym and I saw, I don't know if I ever said this before, but I saw this girl that I was hot for like 8th grade on, Nice. And I walk in the gym and I'm like, she's in a leotard with her butt in my face on the bars right now. I'm like, I'm never leaving this place.
I'm not going nowhere,
I'm never
dude.
leaving this place. And I didn't. I was in the gym every day from that day forward, and I started seeing the results of doing more calisthenics, more, like I would do the dips and the chin-ups and like push-ups like crazy, to the point where between my freshman year in high school and my sophomore year, I came to classes, and one of my teachers, a really nice teacher, I think her name was Mrs. Pope, and she was like, "Are you taking steroids, Prisk?" And she was a young teacher too, and she was kind of hot, and so one of these teachers, you're like, "Oh, this is tough." Anyway, and then she said that to me, and I'm like, "No, but do I look like I gained that much muscle?" And so
you noticed me, huh?
Yeah, so
Look at these fucking guns.
And I had all these stretch marks from just training all summer long and stuff, and it was just a really cool thing. And I never even knew what a roid was until I was over 35. So, well,
but
sooner than that. But I mean,
the attention,
yeah,
the attention is that that is part of that identity. The attention, because it's. I don't know if it's. I'd say the majority of bodybuilders.
Yeah.
Like the majority, it is a visual thing that you're after.
Yeah.
And but somehow it also kept. You can't do bodybuilding if you don't love it. You can't get in there if
there are different types of bodybuilders, right? There's the guys who are like Michael Hearn, out there, who need the attention. They're doing it. Everybody loves them.
He's an alien.
He's an alien, right? And then there's guys that put the hood on, they hide, and you just see them training, and they don't want to be seen. They don't really want to get on stage. They have to be kind of convinced to do it. And there's some guys that are just never going to get on stage. They're just big, and you wonder, where the body dysmorphia is there.
Sure.
Like what's going on with that mind. They're not competing in anything. They're just getting huge for what reasons, right? And
that's what we're talking about here, is the identity of that all, and why people do what they do. And then all of a sudden, like with me, whenever you saw my blood work, you're like, hey, we have some big problems.
Well, and how old are you again?
30. I was 35 then, 36 now.
So
it was you telling me this is how those things that you hear about, bad things happening in people's mid to late 40s, occur.
Right.
I
kind of knew about your history when you kind of retired from bodybuilding. That you had something that went on. I didn't really know what it was. You kind of told me more about it after that, but I knew that there was an issue there, and I had an idea of what that was. And just from people saying, "Oh, it was maybe a kidney issue, maybe it was this and that," and I'm like, well, if he hasn't been watching his hematocrit, he's on all his gear. His hematocrit's going through the roof. He's sledging at his kidneys. His blood pressure's probably going up. He's probably,
all the thing. You're a ticking time bomb at that point. You start to become that, and you don't understand. Like you said, a high hematocrit puts stress on your kidneys.
Yeah.
So whenever we could do this right now, we could ask. Whenever, what are some of the things that I got a ton of questions? What do people do? How do I go to a TRT clinic? How do I know if it's good? It's tough to find a good doctor. It's tough not to get your ass raped whenever it comes to a financial. Some people are charging $450 a month for HRT.
Oh Jesus, that's insane. So there are people that are out there just doing it to make money, and I think a lot of it's just unethical. Totally unethical. And then of course you're dealing with controlled substances too. So I don't see how they don't get in trouble when they're like charging all these extraordinary amounts for.
They come in and out of business every 2 years.
Yeah, right. Yeah, so that's one of the things. You got to do it right.
Whenever someone gets their blood work done, let's say somebody's
wait a second. Don't you have to do your heterosexual life mate thing?
Yeah,
that's
if
not
you want.
here?
Oh no, he's not
you
here.
Got to do your. Oh.
Well,
man.
I got all excited. I got excited.
Don't you have to do your intro? It's this hardworking motherfucker podcast. I'm here with my.
Good morning, everybody. Welcome to the HWMF Podcast. I'm your host, Seth Feroce, here minus my heterosexual life mate. He's busy as all hell. But we have a wonderful guest. The guest who, this is your third time on here?
Third time.
Third time, Dr. Prisk. He is entrepreneur, former IFBB pro bodybuilder, former national, what was it? You were
gymnastics, yeah.
Yeah, you were
NCAA.
an NCAA national
All-American
All-American gymnast, professional dancer, and fellowship-trained foot and ankle surgeon, the best surgeon that I know, probably the best surgeon in the world, in my opinion. I ain't going nowhere else. Even if I got to get my balls chopped off, I'm going to ask you where that should happen. Dr. Prisk.
So, thank you again.
I
don't chop balls off.
I need to get fixed. That does need to occur. I can't.
We're going to fix it. We'll fix it. You know what's crazy is that I had, you mentioned, my fellowship training is in foot and ankle, so my subspecialty is foot and ankle. I do all the crazy hard foot and ankle cases.
Yeah.
So I had sent a prescription for a patient, and they went down to get that filled for clomiphene citrate, I think. They went, it might have been HCG or something like that, and they went to get it filled, and the pharmacist was like, this guy shouldn't be prescribing that. He's a foot and ankle surgeon. And I'm like, okay. And then I'm like, what pharmacy was that? And who am I going to call to say you're defaming my business?
We'll rip your ass.
Yeah. And then somebody else went to another doc, said they saw me for their shoulder or elbow or something, and they were like, he's a foot and ankle guy. I'm like, freaking orthopedic surgeon first. I fix everything.
Yes.
That I feel comfortable fixing.
Sure. That
I do well. I'm a perfectionist, so I only do things I know I can do well. So I'm never going to sit there and go, you know what? That massive rotator cuff tear with that sublux shoulder that needs a superior capsular reconstruction or a reverse shoulder replacement, I'm not going to tell you I'm going to do that because I don't do those. And I know I wouldn't do a good job with it because I haven't done enough of them.
Sure. Yeah.
But you tell me you need a subacromial decompression, a biceps tenodesis, and a small rotator cuff repair.
Yeah.
Oh, it's a no-brainer.
I'm there
Carpal
with
tunnel
you.
release.
Yeah.
No-brainer. Things like that. And so fix a bicep, a tricep, which I do kind of specialize in.
Looks really good.
And I've seen a lot since being on your show.
Yeah.
I've had people come in from Atlanta.
No shit.
Come in from Tennessee.
Well, the thing that that they don't know is they don't know you. They just see a name there. They just see what you're associated with, whatever it may be.
Right.
They don't know that you're a fucking half a psychopath and a perfectionist. No. Like, what kind of asshole is an IFBB pro bodybuilder, a professional dancer? You own your own fucking practices, own the building. Yeah. Like, I don't want to deal with this hospital. I want to do my own thing. On top of all that, I would definitely not want to live with you. So, but going
my wife
on.
says the same thing. Oh, wait a second, I said on.
Yeah. But no, but that they don't know that, and whenever people come and see you, that's the thing. One thing that I've noticed about you is that you genuinely want to help people, and you want to win in the situation. Win meaning like succeed.
The team wins.
Win at succeed at the task or the challenge at hand.
Yes.
You love a challenge.
I do.
That is so. Whenever someone comes in with an issue, you're like, yeah, this is my game.
Yeah. Oh, I just told somebody that yesterday. They were like, "Can you fix my foot?" I'm like,
"Yes,
I can fix your foot."
Yeah, like that, and
it was like your mom's foot, Like,
yeah, like
can
a
you
fucking
actually
nightmare.
Fix this?
Yeah, can you actually fix this?
I'm like,
yes,
I think I can.
But and again, a lot of people say that though. A lot of people have said that in certain scenarios, but again, you're like, there's no minor surgery, just minor surgeons.
Right.
So
and there's 3 types of surgeons, right?
Uh-oh.
Surgeons that operate and get complications. Mm-hmm. Surgeons that don't operate and don't get complications. And damn liars.
Okay.
Okay?
Yeah.
So I always go into surgery with the idea that, I'm going to make you better, but there's no condition that can't be made worse by an operation. So I don't just jump into anything. I'll give you the options if there's an option. If surgery is the only option, I'm going to tell you.
Yeah.
You rupture your tricep, you need a tricep fixed. You need to be able to push. It's like
it's
if you don't get your tricep
math.
fixed, unless it's like a partial tear, and you have some function, you're going to do it.
Sure.
Distal bicep, you don't have to. You're going to lose some rotation. You're going to lose some supination strength, things like that. You don't have to. Pec, don't have to. Things like that. But I'm going to tell you, this is the benefit of doing it. This is what happens if you don't. Will it progress? Will it get worse?
And you're a business. So you don't just make money from surgeries, though.
Correct.
How does a back surgeon make money? Back surgeries.
Yeah, I mean,
And I'm not saying that. I'm not saying that in any derogatory manner. I'm just saying
the back guys have a little bit of a tendency to, not want to see you unless you need surgery.
Oh yeah.
Because there's just so much back pain. Like you could just go crazy seeing back pain in the office if it's like non-operative back pain.
Oh,
so
really?
a lot of back surgeons will be like, don't send them to me. You make sure you have your MRI first. You've had an EMG first.
Really?
These kinds of things, because otherwise they won't even see it in the office. Like, there's a couple guys in town that are like that. And
It makes sense.
it's okay for because anybody can treat back pain. I treat a lot of back pain in my office.
Okay.
But it's like, is it fun? No. 'Cause, it's,
No.
I mean,
No, back pain is-
it's injections, it's therapy, it's bracing, things like
And
that.
I that's was just off the top of my
Yeah.
head. I use that as an example.
Yeah.
But you make money in many different ways through other treatments, your wellness
Sure.
side of things, everything. You
Well,
are.
I like to be able to have everything in one place for everybody's needs. When it comes to, I've got the extracorporeal shockwave treatments.
Yep.
I've got the PRP treatments.
Yep.
I do bone marrow aspirate concentrates, which people call stem cells, but it's really not stem cells. It's bone marrow aspirate concentrate.
Okay.
I do that in my office. I do the. I've got the CT scan. I've got the fluoro-guided injections. I have ultrasound, so I can kind of get a sense of things before we send you out, or we send you for an MRI or something like that.
Mm-hmm.
MRI is just not worth the investment, to do that in the office.
No.
But all the other stuff, got it there.
Sure.
Have all your
And then-
orthotics and braces and things like that. That's all ways to make money in the business. So if you just rely on the insurance companies, just with regards to just seeing a patient visit,
Fuck
the
you.
amounts get less and less all the time. I just discovered with a couple of my payers, I don't think I'm really allowed to say which payers, but there are two payers in particular that I'm going to be dropping, I think.
Really?
Yeah, because they've been paying me less than Medicare for like the last 3 years,
No shit.
and it's really bad. Yeah.
Man, that's not good.
I participate in, pretty much all the payers that you can, right? Like
You have to, in a
Medicare,
sense.
UPMC, Highmark, the Blues, all the Blues.
Yeah.
Aetna, Cigna, United. There
All the ones around here.
might be a couple in that list at the end that
Man.
tend to cut
Well,
you down.
It's ruthless. It's scary.
Yeah.
I mean, anybody in the healthcare industry, like, the more you hear about it, the more I find out about it. Just providing for our company the insurances for our employees, I'm like, this is a wild racket.
You want to know what a real racket is?
Uh-oh.
I was working for AHN Highmark.
Uh-huh.
Signed new contracts in my own private practice, because you have to when you start your own private practice. You have to get new contracts with the payers.
Okay.
I get paid 30% less from those two payers than I got paid for when I was working with them a month before,
Get the fuck out of here.
because I'm a different organization, contracted at a different rate.
30%?
Which means it's actually good for you too, because like if you have a high deductible plan and you come to me, this is a good thing to know. People who don't know this is really important.
Listen up.
Different businesses, whether it's a big system like UPMC or AHN or me, are contracted, or Prisk Orthopedics and Wellness, POW, right? So we are contracted at different rates with the payers than everybody else. They get their own contracts, right? So if you have a large deductible, like $2,500 deductible,
Yeah.
and you come and see me for the exact same visit and charges as you'd see them, you're going to see more come off that you'll owe out of your pocket into your deductible for that visit when you go to the big systems.
Really?
Because they're contracted at a higher rate
Really?
than if you see me.
Get the fuck out of here.
So if you look at your evidence of benefits, you're going to find out that, so I get paid less. So I have to see more to get the same amount of money. But I try to keep it so that
I was just going to say, I can understand from a business perspective, like, that's why they contracted it differently, but that's fucking wild.
Yeah.
That's a racket.
Yeah, so like my surgery charges will be less.
Oh my God.
Now, when you go to the hospital, you'll pay the hospital's contracted rate for the like facility fees and
Yeah,
all that.
for all that shit.
But from like your office visits and things like that will typically be less than going, and that's why some of the
For
payers send
sure.
people to me first, rather than their own systems, which is great. I appreciate that, and
Yeah.
I don't want to. There's a couple like UPNC and Highmark. I definitely don't want to recontract because they are good to me because
Yeah.
they pay me less than what they have to pay their own people. So they'll actually send.
That's fucking crazy. Yeah, but it makes
makes sense, right?
I get it. Yeah,
and,
it makes
and,
sense.
And I like being that because if the systems are sending me people, it's great. I mean, and I do my surgeries at their systems too, so they get the money from me.
Yeah.
It's a nice thing being in private because they kind of watch your business.
Well, yeah, it's ever changing.
Yeah.
Things are always changing, and there's not many people like yourself that are willing to branch out and do your own fucking thing.
Got a couple people that are actually trying to follow me now.
Oh, really?
I have 2 surgeons right now that have been asking me how I did it.
No
and
shit.
they're really getting the ball rolling and
Good for them.
Started, yeah.
Well, I mean, it's like anything. I mean, it's like any person that's going into business.
Yeah.
But you got to have the balls to do it. You got to have the calculated risk.
I've learned so much, the risks, and I've learned so much about what not to do and what to look out for.
Yeah.
I actually enjoy being able to tell them, hey, listen, okay, you need to find the right billing company and what the billing companies.
Oh my God,
so
billing
much
is going to be a nightmare.
Yeah, it's been terrible. I mean, we've had some big issues with that in the last
Money.
years. I mean, just getting the money, but the billing company's doing the right thing, like sending the correct bills and this and that. I mean, it's been really painful. Been through 3 different companies. And then, so learning how that worked, and then learning how to get staff, what staff you need, learning what insurances to get, and things like that. I'm very lucky. My good friend Brian Bortz from Dr. Search, his son is
Bortz.
Yeah, his son is a bodybuilder.
Yeah, I was just going to say.
Yeah.
I know that name.
Yeah, he's a good guy. He won the teen collegiates one year.
That's how I know him. Yeah.
Yeah. I'm sure you've met him.
I've definitely seen him.
Yeah. So, I'm lucky to have guys like that who've been able to help me with that end of things, insurance, and connecting me to other docs and connecting me with the hospitals. But it's really fun to kind of mentor these guys who've been employed just like I was.
Sure.
And 2 of them have been employed longer than me. They've been working longer than me. One's 1 year. Both of them are 1 year older than me actually, and have been in practice 1 year longer. And to be able to tell them, first of all, how great it is to be in private practice. It really is. It's nice to have your own gig. It's good to have pride in what you do and have your own business. I mean,
Feels great.
Feels great, right?
It's a little bit of stress.
It's a lot of stress.
But it feels great.
So how do you deal with that stress?
I don't know. Me personally, how do I deal with it? What I'm doing right now, like the cardio.
Yeah.
I need to be prepared for the day, but the cardio is huge, and then making sure my home life's good. Like whenever you go into your private practice, whenever you do your own thing, in the beginning you're gonna eat some shit. You're gonna eat some shit, and it's gonna really suck. But then is whenever you start to become financially stable,
and you go home to Junior.
And then your family. You go home,
oh my gosh.
and
Such a cute kid.
having a family, having Hannah take care of me, make sure everything's good, and then the kids be okay, and then to make sure that you're building something for them to see. Bro, that's it for me. Is seeing all that come together.
Yeah, right.
But the stress is intense. But but doing your own thing is one of the greatest things that I've ever done. In the beginning, it was because I wanted to do it for myself. But now, with having all the people that we employ and seeing them grow in their particular positions, is a wild thing to see.
Yeah, we went from 3 employees. It was just me, my expert tech, and my office manager, and then to have like 10.
Yeah.
Sometimes 12.
And then also building other people's businesses, helping them build into what they should become, because not everybody is meant to own their own business.
True.
Not everybody is meant to do that.
Very true.
So whenever someone comes in that is just your right hand, everybody knows how important your right hand is. It's like whenever that person comes, they're like, motherfucker, that is it. And then you want to help build that person so that you can do great things together, and making sure that you treat all of your employees well.
Yeah.
So that way they treat you well.
I know I need to do a better job with that. My employees are listening and watching.
Yeah.
Yeah, I got to work on that. More praise, because I get in the moment of working through the office, and then I get stuck on the things that need to be fixed right away that are either patient risks or, things that are going to make us lose money or something like that, and I get kind of in that, but I don't remember to praise them and tell them that.
And again, I will say what happens here. I've become better. My dad was a micromanager. I am too.
Yeah, me
like
too.
if I get really into it, I'm really bad at it because
It's hard to give that up.
oh,
That control.
It's a control factor, and that's
Well, you
why
did that in bodybuilding. You controlled your food, you controlled your training, you controlled your sleep, you controlled your supplements, you controlled it all.
Everything.
Gymnastics is the same thing. It's constantly doing the same routine. You got to do it over and over, and so it's perfect.
So what my dad, because whenever we were talking, my dad has talked to me about how much I've evolved as a person, and that was something I mentioned in the video yesterday. And I was like, man, it makes sense. And he's like, you did it. He's like, you have other business partners that are better at certain things than you are. And he's like, you're obviously learning. He's like, because some of the other guys have evolved, Pat being a strong point in that, where he's like, we're going to let the people make mistakes, but we're going to be right there to watch them. The only way you can watch them is if you have enough people.
Yes.
Because because my dad was a sole owner.
Yeah.
Like yourself.
Yeah.
And motherfucker, it got intense. And like my mom used to talk about how dude would be sleep at night reciting numbers, talking about his taxes.
Oh,
like
yeah.
he'd be in his sleep going over numbers.
That's a little intense.
Because it was just him, and he had his wholesale, he had his countertops, he had his demo crew, he had his remodeling crew, he had all these people, and I'm like, bro, you were fucking crazy. Now I know why you were a little fucked up, and now I know why he had really bad habits and all these things.
Yeah, right.
And I'm like, it all makes sense, and but for us, that's one thing that why it's so beneficial to have multiple people, because they're able to say, pump the brakes, we need to do this. And even though there's days whenever those three will be like, hey, you need to pump your fucking brakes. And I'm like,
it's tough for me because even right now I have my PA right now, Dana Kelly. And her brother's a bodybuilder. I don't know if you've seen
he lives.
Dave.
Yeah.
So Dana's been really great. She's been learning a ton, and right now she's in the office seeing patients. And I took today off.
Yeah.
And I'm trying to enjoy my weekend, but I got a little anxiety, like how people are doing and stuff, But
it's 8:01. Is everything good?
It's definitely gotten better. Yeah, so I've been better at that. So, but they my extenders know that they can call me with anything, and I have Bernadette Sherman. She's a doctor of nurse practitioner, and she does a lot of the hormone replacement stuff.
Wonderful.
Now, does that on Thursday mornings when I'm in the operating room sometimes, and
Fuck yeah.
I'm always immediately available and ready to talk. I'm right down the hall basically. So anytime they need anything, it's easy, and they're all on point with what I like to do, and know when to say, hey, maybe you just need to go see Dr. Prisk by himself again and just go over things. So a lot of you out there, if you're looking to come do the HRT thing, you might see Bernadette first, and if you want to see me, you just say, hey, you know what, I'll see Dr. Prisk on follow up on the labs and stuff.
And that's
cool.
but that's part of you building a practice.
Yeah,
and that's part of you choosing that person for that position.
Yeah, she's a former competitor herself.
Oh yeah.
Very good looking, guys.
Oh, nice.
So you might like her.
No touching.
She's got a police husband, so John Sherman. He's a
John Sherman.
Yeah, you may have known him from the gym or something.
Oh, I definitely know that name.
He's a Wilkins cop.
Okay.
Yeah. Great guy. Awesome couple. They're great people, and I spend a lot of my holidays with them.
Oh, nice.
Yeah. So
great. That's exciting.
But yeah, Bernadette, I've known her for a long time. And she does a great job doing. She was like doing primary care for forever, and she does nursing home work as well. So she's good with, doing your blood pressure, all that kind of stuff. So tell me, you were about to tell me about what was going on with you right before we got into this conversation. You're going to ask me a question about stuff.
Just in general, the people with. I just posted that video. Why I quit taking steroids. Big thing for me was.
Yeah, I only saw that. I didn't get a chance to watch it.
No, I clickbaited everybody. I'm going to start doing clickbait videos to fuck with people. Just be like everybody else on the YouTubes.
Yeah.
So I can just. I'm just going to say why I cut my balls off.
Yeah.
Actually, I just got snipped or something like that.
Yeah,
You can't take YouTube too serious. I think a lot of people are getting wrapped up right now on everything, especially with COVID, a lot of judgment. Like people were just always on the internet. Mm-hmm. So whenever someone posts something that they don't like, or anything, they're quick to like tell them they're fucking idiots or they didn't like it, and it's all that. But I can't take it too serious. We have wonderful companies. People support them.
Yeah.
I need to do more YouTube videos. So that was the one that I'm like, all right, out of the gate, here we go. And then we have a couple others that are going to be fun planned for next week and the week after.
Yeah.
And then just continue to evolve from there. But
nice.
A lot of questions I got about like How it got started, and it was just because simply I grew conscience. My son, you telling me, you're like, hey, dude, this isn't cool. So if someone was to get their blood work done, say they didn't go to a clinic, they're like, I just need to get my blood work done because Seth told me I got to get my blood work done. So then they go pay, they get the blood work done, and they're trying to read it.
Yeah.
So what are some of the indications that people should be worried about out of the gate if they're anywhere between the ages of, like, say 28 to 40 years old, and that age range for me,
Right.
of saying they've been on some shit, they like it, they're going to keep taking some steroids, they like cycling,
Yeah.
they do their own HRT dose of 200 or 300. A lot of people said they do their own thing, and I'm like, don't do your own thing. It's a really bad fucking idea.
Yeah.
What would you say are some of the things that they should immediately watch for in their blood work that would be like, go see a doctor, go do this, or go to an HRT clinic, or what are some of the out of the gate things to look at in your blood work?
Yeah, so that's a really great question, and it's a long one. So
Yeah, we're ready. I'll ask.
buckle in. We got a lot of things to talk about there. So there's a lot of things that go into what you order. Okay, so
Full panel.
if I'm going to do a full panel,
Yep.
comprehensive metabolic panel, it's going to be your first thing, right? You're going to have your liver function tests in there. You're going to have your creatinine. You're going to have so it's your kidney functions, and you're going to have some markers that are going to help you understand some of the toxicity that can happen, right?
Yeah.
Comprehensive metabolic panel. In particular, you're going to look at the AST and ALT. You're looking at those liver function tests. Now, if you're seeing a little bump in those tests, that can be very common in just training.
Sure.
The stress of training can elevate,
Slightly above average.
AST a little bit elevated. ALT, that one shouldn't go up as much, but you're going to have some of these little elevations in AST and ALT, right?
For someone who lift weights and eats a lot of protein.
Trains, eats a lot of protein, whatever. But just, if you're seeing those numbers double normal, particularly, you got to get checked. Now, that's going to happen whenever you're using oral gear.
Okay.
Oral gear, I've seen levels go up to in the 400s. It looks like freaking hepatitis sometimes.
400's a little high.
Yeah, I know. A particular Mr. Olympia that I've known for many years. It lived in the 400s. Just all the time. If you're taking 200 milligrams of Anadrol a day, you're going to have a liver function test. They're going to be through the roof, right?
Yeah, dude.
So
yeah.
you got to watch that.
Yep.
So the toxicity to the liver is always going to come with those orals.
It's just going to happen.
Anadrol, D-bol, Winstrol's pretty bad. Anavar not as much, but when you're getting above 50 milligrams a day, you're going to have liver function
which
test
is going to fucking happen
with Anavar. So if you stay under 40 milligrams a day, actually, under 40, 50 milligrams a day on Anavar, you're pretty safe.
It's known to be a mild side effect drug.
Yeah.
A little milder.
That's why women use it. So Winstrol not so much. Everybody thinks, I put women on Winstrol too. It's a little bit more.
Winstrol's a little nastier than everybody likes to
more
think.
More that DHT effect, more of that androgenizing effect. It's not so great. So, and horribly toxic to your lipids. Okay?
No shit.
Yeah. So we'll get into that. But that's another test you want to get. But so you're looking at your liver function tests, and then you're looking at your creatinine. Okay. So your creatinine is your level that you look at to see how much you're clearing creatinine. Creatinine is a breakdown product of creatine.
Sure.
Right? Muscle breaks down, you get creatine released, and it turns into creatinine, right? And if that builds up, that's a way that we can see that your kidneys aren't able to filter out toxins in your blood, basically. So as that rises up, and we don't like to see that rise much. It's almost like an exponential thing. The more it rises, it's actually becoming more and more damage to the kidneys. So it's one thing if you're like around 1.4, but then you start jumping into 1.8 is a lot different than if you're at 2.8. 2.8 is something really bad's going down.
Oh, no shit.
Okay. You're doing a lot of gear. You're getting high blood pressure that's causing renal artery stenosis, or renal artery stenosis causing high blood pressure, things like that are causing constrictions at the kidneys, or you're getting toxicity at the kidneys as a result of you're training really hard, you're taking way too much NSAIDs like ibuprofen or Aleve or things like that, and you're just blasting your kidneys. And you're seeing these elevations. You're dehydrated, and then you're doing the same thing. You're dehydrated, taking ibuprofen, and your blood pressure's through the roof because you're polycythemic, or you've been on gear for so long that your blood vessels are getting super tight at your kidneys. Then that's where you're going to get this kidney damage.
And those are things that you really that people can just completely disregard.
And they just won't know. Yeah.
They won't even know.
If you're not checking your blood pressure, you don't know. You should be checking your blood pressure pretty regularly, especially if you're on gear. That's something you need to do.
I didn't.
You got to be doing it. And it's hard because you get big arms, you get
the
cuff and stuff.
I'll
you
do
can't
the
just
little cuff on my wrist, or
so you can do the wrist cuffs.
Is that a good thing for people to do?
It's at the level of your heart when you're doing it. That way you're.
Whenever
if it's too low, it'll be higher blood pressure, right? So you want to.
So if people do get the wrist cuff, I'm an asshole for saying that. It will work.
It will work.
It's a good idea for people to use.
If you can't use the upper one, at least use that. It'll
then
be a
keep
good
it
way
at
to
the
follow
same-
where it's going, especially.
Okay.
Yeah. So yeah, certainly if you can't get one on your arm, get one on the wrist cuffs at least. I even use those in the office sometimes.
Oh yeah. Okay.
Yeah, just for speed. But yeah, that's one of the things. So non-blood work things that you should be doing at the same time while watching your kidneys and your liver is checking your blood pressure. Okay. If you're constantly red in your face, like you see these guys, they're
maybe a little purple.
Yeah, I mean, I'm like, okay, how much Anadrol are you on?
A lot.
Because you're going to be polycythemic. You're going to, be high blood pressure. Those people, you can see it in their face.
Yeah, I mean, I do see it. It's one of those things. Especially, I've seen it with older gentlemen, guys in their 40s.
Yeah,
and then like right here, like right here, purple.
Absolutely right.
And red on the cheeks.
Just saw a guy like that yesterday.
And I'm like, guys, okay. I know you're going to tell me you're only taking 500 mgs. I know you're going to tell me that, but I know you're fucking taking more.
Who knows where? If they're not getting it from a reputable source, they could be taking a lot more or a lot less.
Yes,
but
and that's a whole nother box of worms.
Okay.
But
we'll keep going with the labs. Okay.
So labs, we did the.
So that goes on the same thing
metabolic.
I said about. So we get the comprehensive metabolic panel, and then you're going to get the your complete blood cell count, right? You want to know what your hemoglobin hematocrit are.
Yeah.
You want to see if you're polycythemic because steroids boost production of red blood cells in the marrow. Used to be the number one treatment for anemia. Back in the early days, they used to use that.
That's why they created
until
it.
EPO came out. That was what they did.
Yeah.
Right? EPO is what was used for. So, and it was actually used for kidney failure, right? So, nandrolone used to be used to boost red blood cell count.
Yeah.
In patients with renal failure.
Does a good job.
That was its original indication.
Yeah.
So, people would, then they switched to EPO, but. So you have to watch for those elevations because your blood can be like sludge. I mean, I'm seeing, hemoglobins in the 20s sometimes. I mean, it's ridiculous.
Bitch.
Yeah, and those are the ones that I want. As soon as the lab comes across my fax, I call them and say, "Listen, dude, you got to go get some blood donated." And in a lot of the blood donation places, you come in and you show up plethoric and
all
big and
fucking jammed,
all jammed up. They will not take your blood.
No.
So I will write you a prescription for a therapeutic phlebotomy.
Yeah.
And we'll keep finding out,
Yeah, you just keep going.
And we'll see where you're at and get you into a level. And then sometimes I'll send you to a hematologist.
Yep.
Just to make sure.
Yep.
Because if it's really bad, you never know.
You haven't referred me to one bad person, by the way. Everybody you've referred me to has been absolutely fucking stunning. Okay, keep going. Sorry.
Okay. I try to keep the good folks around.
Yeah.
And I'm on the med exec committee at the hospital, so I know all the good docs, and we're all good.
Plays a huge
bunch
role.
of guys, yeah. And we're at my hospital where we're at UPMC East. I'm on the med exec committee with a bunch of other private docs. I'll tell you, private docs are, they're going to make time to get you in. They're going to get you there. They're going to take time with you and stuff like that.
They also take pride in their employees and pride in their shit.
Yeah.
Yep.
Yeah. So anyway,
moving on.
Let's not be too ADD today. Drink more coffee. So then, you get the blood donations. You kind of follow that. You got to watch that closely. That's probably one of the biggest things for young people using gear, because they're the ones that still have that really active marrow, and they're going to be producing a lot more. And so, yeah. But then, if you're doing it at a young age, even the older guys, and they start getting higher, that's where, they're starting to get issues with the high blood pressure, putting them at risk for stroke. And I mean, even at a young age, you can have a risk for stroke, from the high blood pressure. So I've seen it happen, and even blood clotting. So A couple of things you can do right there is, number one, if you have any family history of like aneurysms, brain aneurysms, things like that, and you're on gear, man, just go see. You can see a neurologist, or you can see a neurosurgeon or somebody that specializes in brain aneurysms and stuff like that, and just get a prophylactic MRI arteriogram. So
That's hard to go ask for, dude.
yeah, I know, but
that's-
usually when you have a family history, they tell you to do that. So,
Oh, really?
Yeah, but yeah, if you rupture one of those bad boys, even at a young age with high blood pressure, you're in big trouble. So it could kill you. So that's something, keep in mind. If anybody in your family's had a stroke from an aneurysm, you need to be checked.
Okay.
Okay. So anyway, the next thing, on that CBC is going to be looking at your platelet count too, because sometimes you get like stress can elevate your platelets, and sometimes if you get high platelet count, you can end up with issues with clotting as well. So increased risk of DVT. You go out on an airplane, you sit on a plane, and you get a DVT. Travels to your lungs, kills you. It's one of the
That happens.
between heart disease and blood clots, it's probably the two number one killers from using steroids. Okay, so now I say this with some caution. Now, what I say for people who have a tendency towards these elevations is to take a couple grams of fish oil a day, because it gives you a bit of it helps with the elasticity of your blood vessels. It helps with
We should all
better flow.
All people that train hard and take steroids should be doing those things anyway.
Yeah. So, but a couple grams of fish. It's like you can't just take fish oil, but still have like, all these omega-6s in your diet that are like horrible fats, processed foods, and things like that. It's like throwing a deck chair off the Queen Mary and hoping that you're gonna lower the weight. So it's you have to have that balance. It's all about the ratio.
Yeah, you're right. That's hard to say.
So if you're eating fish, you look at salmon, you think you're doing the right thing, but it's farm-raised salmon that are fed on corn and grains and this and that, and they don't have any omega-3s in them. You need to get the wild-caught stuff. You got to actually spend the money, and you got to get things that don't have it. Don't have the bad saturated fats and the processed foods with the omega-3s. So it's all inflammatory fats. So you got to do that. But that'll help kind of get those red blood cells kind of flowing through the vessels a little bit better, a little more elasticity. GNC's triple strength fish oil is like one of the best on the market, by the way. I always say that.
Oh, no shit.
I don't work with GNC anymore, but they do have a really great fish oil.
Wonderful.
Do you have a fish oil?
Yes, we do.
Oh, sorry. Well, there you go.
That's okay. No. Well, again, it's...
Let me see it.
Everybody... It's over there.
Okay. It's great fish oil, right?
Yes,
low
absolutely.
rancidity. Is it enteric-coated?
Yes.
Yes. Perfect. Okay, cheers.
So
get their fish oil.
But no, it's regardless of it all, these are things that people need to make sure that they do for...
Yes. And so then the other thing I would say, the one I was going to say with caution, is taking a baby aspirin.
You had me doing that whenever...
Yes.
Yeah, you had me doing that.
So if you don't have a history of GI, like ulcers, reflux, bad stuff, it's pretty safe. If you do have those risks of the aneurysms, that and high blood pressure, it might not be good because it's a blood thinner, but
all these
certainly.
things that we're talking about, like how you get very individualized, is so important. Why you need to see a doctor.
Exactly.
Yeah.
Right. Because you don't want to just.
We can't just go out here fucking. You say with caution, caution, and it's like maybe you should go see.
I hate
a doctor.
to be the guy that says that, because they're like with caution, because
it could be maybe just 50%.
We're on this fun radio or this fun podcast where we're talking about, being libertarian, you do whatever the fuck you want, kind of thing.
Yeah, but no, it's all. This is all geared towards health. These are things that again people have the most questions about. And I mean, you didn't even get into the endocrine system yet.
Yeah, well, we haven't. Yeah,
No.
So I'm just telling you the things that you really got to watch out for.
Yeah, and these are things that I after going through this, heart, kidney, liver, lungs, and gut.
Yep.
Those are the things right now for me that I'm like, I mean, lungs, I do smoke cigars, but it's kind of like
it's not the smoking things that you worry about with bodybuilding, right? If you have a bigger than a 17-inch neck, your chances of having obstructive sleep apnea are like almost 100%.
Yeah.
So you have to get that checked. If you have terrible sleep habits, you're snoring bad, you need a sleep study. When I was preparing for 2016 and I gained like 40 pounds of muscle in the course of 3 months, I went from Yeah.
Yeah?
Someday, if you want to talk about how I did that, we'll be glad to go over.
Well, that's another one.
That's a whole nother one.
We could go about stories.
I
That's
did. I went from
people,
160 to 200.
people were asking about story time
and
next.
this little
so we'll
5'5" frame, and short order. But I developed obstructive sleep apnea.
Well,
No doubt
Bob
about
would
it.
always worry about me whenever we travel. He's like, bro, you fucking snore so bad, it's scary. He's like,
And it's not the snoring I worry about. It's the apnea episodes, which you don't stay awake enough to hear.
He's like, I worry about you because he's like, I could have swore you stopped breathing quite a few times.
Oh, sure. Yeah.
And I'm like, probably. And that's whenever I was 240, 245 pounds. And it's just, it's you say fuck it.
Yeah.
You say fuck it until you grow conscious. If you grow conscious, all of a sudden you're like, hey.
But here's the thing: even if you want to be that big, you need to treat that with the CPAP. You gotta do it because you will sleep better. You'll have better recovery.
We're talking 1 out of fucking 50 doctors is cool enough. You know what I mean? That's where it comes tough. Like that's why you're here and why people go see you and why these things, because you're like, I get it, dude, but here's the thing. I'm going to be up your ass a little bit about this, okay?
Yeah. Oh, yeah.
Because you're going to fucking do it. I know you're going to do it. But this is what you got to do. And I'm not saying I condone it. I'm not saying great,
Right.
but I'm saying I care about you, so let's do this.
If I put you on testosterone, you come in and your testosterone level is 300 or 3,000 when you come in. I know what the fuck's up. Or if you come to me and you tell me, hey, I've been off everything for forever and your pituitary is still completely shut down. It's pretty rare to be off everything for a long time and your pituitary to not have a little bit of recovery.
Sure.
You know what I mean? So
Maybe crashed it.
Yeah, I know what's going on. You can't hide that from me.
Yeah.
And I know this industry and bodybuilders and
You were
everybody.
it.
I know
You were
everybody
in it.
that was in it. So I know if you're trying to F with me. But so don't. Just come in and be honest.
Yeah. It makes it much easier.
Yeah.
Makes it a lot more fun.
So, yeah. And I tell that to everybody. I said, tell me what you did. Really, tell me.
Well, big thing people are worried about, I said in the video, people were worried about their life insurance policies.
Right.
They're like, oh, they're going to find out if I go to the doctor and they're going to find out I have all these problems. And it's like, and you were like, no, they only know if you tell them. And I'm not going to share.
It depends on. You have to be careful with the diagnosis codes that are used.
Oh, okay, tell me all about it so people know then.
Yeah, so if you go to a doctor who's not really familiar and you tell them all about your steroid stuff, that they could put in abuse of anabolic steroids as a diagnosis code.
Oh shit!
And as soon as you put a diagnosis code into billing to insurance, or have records like that, and you go to get insurance policies, like for disability or for life insurance policy, they have access to all those diagnosis codes
Oh really?
that have gone to insurance. Yep.
So
another option is just to not go see anybody on your insurance. You can always do that.
for lack of me understanding, can you explain that a little bit more?
Well, yeah. I mean, if you go to so this is what happens. They have these systems. I don't even know what the databases are or whatever, but if you put a diagnosis code on your chart for whatever, and you go to get insurance, somehow the disabilities and stuff, they have access to every doctor you've seen somehow. Even you're supposed to tell them, of course, every doctor you've seen, and you should not lie. I'm not telling you you should not lie.
Nope.
Because that is insurance fraud.
We're not.
You
Okay.
could, federal offense, go to
Okay.
jail, whatever
Not
else.
lying.
You should not lie. But you just need to know that if you went to see a doc and they gave you, and it was on your insurance and they put it in there, they're going to find it.
So, and you said, but if they're not on your insurance, HRT clinics that are all over the country,
Yeah.
they're not done through insurance.
So,
Are they?
So essentially those guys could fly under the radar. They could, unless they prescribe you something and it goes through a pharmacy and they have to report that. Pharmacy has to report the controlled substances. So I know there are some compounding pharmacies out there that don't report it for your state. It can be an issue for the people who are prescribing in the state, right? So if they don't put it, if you put anything into the pharmacy, they'll know that you got that prescription. They can find any prescription you've ever had.
No shit.
Yeah. I don't know how the systems are all worked together, but we do have systems for the state to help protect against, overprescribing of narcotics and controlled substances. We have to check anytime I prescribe you testosterone or something like that. I have to check the PDMP, they call it, in Pennsylvania drug monitoring program, and we have to find out, if you've gotten it from somewhere else. If you've gotten testosterone before, I can see it. if it's been prescribed by Rite Aid or Giant Eagle or wherever else, and it tells me what physician prescribed it. So you have to look that up.
Holy fuck.
So yeah, I mean, all this stuff is out there, but I don't want to scare people from getting treatment, though. And so
let's get into that real quick. I got questions. So
we haven't finished the lab thing.
Go over the labs.
You got questions? You got a good question first?
I got a million fucking questions,
well,
Doc.
I don't want to ruin your train of thought on that.
But that scares people. So how do we find a doctor that isn't going to put down that code of abuse of steroids? Because that's a big code that can...
Just ask them.
Yeah.
Why not ask
Okay.
them? What diagnosis codes are you going to use for this? Because, I really don't want anybody to know about it or something like that, or the stigma of it or whatever.
Yeah.
You can ask them.
Okay.
Yeah. I mean, it's not being dishonest to not put it on there.
I was going to say...
You have hypopituitarism, you have low testosterone, you have, these different diagnoses. I mean, anybody who's used stuff is going to end up with the shutdown thing, and the shutdown thing is real. So there's no doctor should ever feel bad about trying to turn it back on.
Well, that's what I was my next question was if they came for help.
Yeah.
And they want to get better.
Then they just want to get back to normal.
Yeah.
Or they want to come off.
Yeah.
And they don't know how to come off,
Yeah.
or they're afraid they're buying some stupid research chemical that's not real, or it's
Yeah.
toxic, or could have purity levels that are who knows what,
Sure.
from China, in some liquid that you say, this is a research chem, and you take a couple drops of that and you're getting 20 milligrams of tamoxifen or clomiphene or whatever. You have no idea. No idea.
Nope.
And those aren't benign drugs,
Nope.
as everybody thinks they are.
Really?
No. Horrible. I think we went over that before.
We
But,
did. That's scary.
It's scary, yeah. You add tamoxifen to polycythemia and lose that estrogen effect on your blood vessels, and
Not good.
Bad combination.
Yep.
Okay.
Okay,
Now,
let's go.
So
Back.
So backwards. How are we doing?
Good. We're great.
Well, I guess we can get into the hormone side
Yeah.
of things. So part of your tests are going to be, checking your pituitary, the hypothalamic pituitary axis. Is that mine?
It's not me.
Is that me? Where's my phone? Let's make sure it's not the hospital or something. Probably a spam call. My auto
Your auto
loan is up.
or your
Yeah,
what is it,
something
your
like
extended
that.
warranty.
My extended warranty, or
Maybe,
yeah, it's
maybe it's Sirius XM telling you about how you can re-up for half the price. That's the other one I get right now.
So anyway, we're talking about the HPA, right? Hypothalamic pituitary axis, adrenal axis, and we're talking about the testicular axis between your pituitary and your ball sac.
Yep.
So everything is supposed to be in balance. We call it homeostasis, right?
Okay.
If your testosterone levels jump up, your pituitary says, testosterone levels are too high, by seeing estrogen.
Oh, really?
What happens when your testosterone goes up?
Uh-huh.
Your body converts testosterone
To estrogen.
to estrogen through aromatase. And it's actually that estrogen that has a negative feedback, because obviously if your testosterone goes too high and your estrogen is going to go too high, your pituitary is going to see that and shut down testosterone production.
Gotcha. Understood.
Okay? So you take exogenous testosterone, now your levels are like 1,200, 1,500, 2,000, greater than 2,500 sometimes on the labs where you can't even measure it, right?
Been there.
Been there, right? So when you look at it, that's going to turn off your pituitary completely.
Gone.
And
Not working.
no matter how much you take and no matter what drug you use, even some of these stupid SARMs that people think aren't going to do it, don't use SARMs. Guys, these things are whatever they're selling. Just don't do it. I'll get off that box. Okay, so they shut everything. Even the lowest doses of Anavar will shut down your pituitary.
No shit.
Yes.
Okay.
Okay? So you're going to stop your own testosterone production. Now, you do that long enough, your testes become, even one cycle can shut down your testes enough that you actually lose some of those Leydig cells and you just don't ever make the same level of testosterone again.
Yes.
It can happen just from one cycle.
Believe it.
Okay? Believe it. So now you got to figure out how to get everything to come back on, right? So
Back
we're
to
gonna,
homeostasis.
Yeah. So there's a few things we're going to look at. If you've been off and you're still low and things aren't functioning, you got to figure out why. So there can be some other things that cause shutdown, right? So we look at your prolactin levels. Prolactin is a hormone that can actually kind of shut down testosterone production as well. So hyperprolactinemia could be from pituitary adenoma producing that. Sometimes we'll do a brain MRI, especially if we see elevations in prolactin. We'll check that just to see if you have a prolactinoma or not. I found many of them over the years. So you got to see if that's happening, because you can shut that prolactin down with some carbogoline and things like that. If your prolactins are very high. Now, I see people using carbogoline over and over again.
The cabbers.
Cabbers, right? They're using way too much of that for.
I heard they're a little
gyno and
dangerous.
stuff. They don't need to use it.
People that are on big high
if you
amounts
know
of
your
nandrolone.
prolactin levels are really high, then you might want to consider getting that treatment. And because you're having drainage, you're having bad gyno, certainly.
I never really
with
fucked with them.
Yeah, you shouldn't need to. Most people wouldn't need to. It's very
It's
rare.
it's commonly used. Cabbers are commonly used.
I know, it's terrible. It should not be done.
Really?
Yeah, really don't need to be done. So
But
check your
people
levels.
want-
If your
people want-
prolactin is very high, then you should talk to an endocrinologist about getting that down.
People take a bunch of fucking nandrolone, okay, like because they love DECA. It's a great drug, but then they're worried about their dick and their libido, so they take high amounts of nandrolone in like say like an off time, and then they're taking a cabber with the high amounts of nandrolone. Am I thinking that's the right thing that they do? I don't know. I never got into it, but again, I never got into huge amounts of nandrolone either.
Yeah, and
Am I?
the more nandrolone you use, the more you get more estrogen conversion. There's a couple of estrogen compounds that are made from nandrolone, and that can be a problem. So, and it's kind of thought that the lack of conversion to DHT is kind of contributing to that loss of the sex drive component of things. You kind of never want to run it by itself. You just shouldn't. If you have testosterone on board, you shouldn't have a problem with it. Now, if you do get hyperprolactinemia, you should see that in your labs and then treat that. But I think nandrolone gets a little bit of a bad rap, when it comes to, that DECA dick kind of thing.
Yeah.
It's probably something else you're doing with your cycle not correctly. You're not using the right things. And you may be using too much anti-estrogen or something like that. That can affect your sex drive too.
Too much antis affect your sex drive like crazy, and people do not know that.
Yeah.
High amounts of Arimidex, like they'll do 2 mgs a week, 3 days a week, or every third day.
Yeah.
It's a little high.
Yeah, I mean, and I can't emphasize enough how important it is to have some estrogen in your system. And you're using that much, you're going to have zero estrogen in your system.
Yes.
When women go through menopause, they have no estrogen.
Yeah.
They go from being cardioprotective and being like a very low rate of heart attacks to all of a sudden after like age 50, you go through menopause and you have no estrogen. Their rate of heart disease and heart attacks increase to that of men, like almost instantly.
No shit.
It's because of the lack of estrogen and the protective effect it has on your blood vessels and the elasticity of things. Your tendons, they end up having the higher rate of tendon ruptures like rotator cuff, bicep ruptures. If they're going to get it, it happens once they hit menopause.
So, man, they just get all fucked up. They go through menopause, go through all this bullshit, all the hot flashes, and then they start getting all fucked up and injure themselves.
Right.
It sounds horrible.
Yeah, joint pain. So that's exactly what you're doing to yourself. You're putting yourself in menopause. Menopause. But yeah.
I mean, it makes sense. The mood swings become drastic and very scary.
Yeah. So so now we're looking at that pituitary, and we're trying. So now we have your FSH and LH, which are follicle stimulating hormone and luteinizing hormone, and that luteinizing hormone in particular is what kind of turns on that testosterone production. The follicle stimulating hormone is kind of like the follicles or sperm, kind of turning on that kind of fertility stuff. So there's a whole other side of whether you're coming off and you want to have a baby, and there's a whole side of just coming off and getting back to normal, right? So we can turn the pituitary back on, but then maybe the testicles are already burned out, like they're scarred or they just don't have any Leydig cells anymore, and you can't turn that back on. So that's what you have to figure out when you're coming off. So if your FSH and LH are like through the roof and your testosterone is really low, it's testicular failure. There's something going on that's not seeing those high levels, and so we can make the FSH and LH go up with clomiphene citrate. Now, clomiphene is a really great way to replace testosterone without taking testosterone. We get people into just taking 25 milligrams a day or every other day and taking the weekend off. You can actually get testosterone levels to be in the 1200s.
Get the fuck out of here.
Not kidding. Yeah, if your testes are working well, you can get them way up there.
Again, this just goes back to individuals
and there
seeing
is
a doctor and
there are some researchers have shown, and there's been a couple studies looking at some longer term effects of using clomiphene citrate as a hormone replacement. And I have a number of patients who do great with it. I've got a couple guys who've been on it for a couple of years.
Oh,
you know,
shit.
and we take a little break now and then because you can get a little bit toxic because it has a long half-life. So you
Sure.
don't want to take it so much. But we have some guys who just feel great taking 25 milligrams, half a tab a day, or every other day, and do very well with it, with high levels and getting their libido back and all that kind of stuff. So it's one of my go-to for the young guys, just getting things on. Now, if we notice that you get the elevations, the FSH and LH, but you're not getting the testicular function again, there's not a ton we can do about that. Even at that point, if your LH is way high, adding HCG ain't going to do shit if it's not working, because HCG is LH. So everybody asked me that. Well, what about doing clomiphene? And there was a study that looked at clomiphene, HCG independently, and then combining the two, and the clomiphene by itself was just as good as any of those.
No
There
shit.
was no statistically significant difference. I can
See,
show you the study.
So these are things that that I don't, because I don't research this shit all the time. Yeah. And a lot of people it's all hearsay. Mm-hmm. I mean, I've even said it too. I'm like, oh, maybe you should do HCG and Clomid. Maybe you should do this. Maybe you should do that. It's just lack of true knowledge of this and getting into it. And that's, again, why it's important with you and anybody that is well educated into it or anything like that, because...
So clomiphene citrate should be your go-to to figure out.
But here's the gig, though, dude. You just said it as well. Like, do you know how great it is to have farm-grade shit? Not everybody gets that. It's really difficult because I can go on here right.
Citrate's cheap. You go to the doctor, you prescribe it. It's not a controlled substance, and it works.
Oh, it's not a controlled substance
No.
either? Oh, that's wonderful. That's great for people. But what I mean is, it's easy for me to get. I can go get it for fucking $40 right now. Get like a fucking 10 cycles. I get 10 cycles of fucking Clomid for $40, something like that.
You can get it cheaper than that at your pharmacy on your insurance.
Really?
Yeah.
Man, that's great. Great to know.
Yeah.
Great to know. These are all things that everything that we're talking about right now are things that people don't know.
Yeah.
It's not well known. These are things that why going to some type of wellness clinic for this, a TRT clinic, is nice. And
Well,
not every,
I'm going to tell you that there's not a lot of TRT clinics that are going to say, hey, let's try some clomiphene, because they don't
Fuck
make any
no.
money on it.
yeah, that's true.
They give you so there's a popular one in town. They like to prescribe you testosterone. They charge you $300 a bottle.
Yes, that's
$300 or $400, I've heard. Or they say you got to pay a $450 monthly fee to get it.
Yes, I've heard that. And again, that's that crazy thing. I'm like, holy fuck, and it's. But
Anyway.
I'm not here. Again, that's part of business, and that's part of everything.
Yeah,
and
it's okay with
every
that.
single
if
thing.
they do it and they can do it, and fine. But I hate it
Because-
when leasing people.
Yes, and that's it goes back to every single industry, whether it's supplements, surgeries, fucking food, you name it. Same product here is twice as much at this grocery store. It's just
Dude, I could do so much more, like stem cells. I could just go out there and say I do the stem cell treatment, because I do what everybody calls stem cells, right?
Well, you
The
said it's
bone marrow
bone marrow-
aspirate concentrates
Uh-huh.
for arthritis and things like that, where you take your bone marrow. It's an expensive process. The machine is super expensive, and so it costs
Fuck
like
yeah.
$3,000. But there are people,
bitch.
yeah, for one shot.
Oh,
But
bitch.
there are people who are charging $8,000-$9,000 for not only for sometimes they'll do that. Like I know the Regenix folks, they charge I think $8,000 or $9,000 just to do the bone marrow aspirate. They call it stem cell treatment, by the way, which it's not, right? It's concentration of your
Hey, dude,
hematopoietic
I don't mean.
cells.
I'm gotta ask a question. If you're saying it's 3 Gs, that's a lot of money.
Yeah, these guys are doing it for $8,000-$9,000.
But listen, I make a lot of fucking money.
People are desperate when they have they need a total joint. They have arthritis, and somebody says on a radio show or on a commercial
Advertisement or
they
anything,
do their
whatever the
little
fuck it is.
seminars over at the hotels where they say, come see this chiropractor talking about stem cells, and they say that they can help you avoid surgery by doing this. they're going to pay whatever it takes.
But it ain't covered by
And
insurance. There ain't no fucking way it's covered by insurance.
Who take loans from, and they have these loan programs, some of these places, where they say, you know, we'll sign you up for a loan. There was one guy, it's a chiropractor, not even allowed to do it. So they have like a nurse practitioner or somebody comes to the office and injects. There's a couple of them in town that do that. And what they do is they have these seminars, and they have you sign the consent for it. They have you sign the papers for the loan before you even leave the seminar.
It's like a Ponzi scheme.
And the chiropractors are consenting them,
Damn.
which is illegal.
God
That's
damn
They
it.
can't do that.
God damn it. God damn it.
Yeah, I'm involved in a lawsuit right now where I'm helping an attorney out where this is the case.
That's so much money. No, here's the question. I understand.
And that's for allogeneic stem cells. Not even an aspirate. That's all they do is buy a vial for like $750, thaw it out, and inject it to you. And hope to God that nurse practitioner or whoever it is they have hired to do that injection knows where they're putting it. One person said that, oh yeah, I went and got this stuff. I paid $4,000 or $5,000 for it, something like that, and it's a vial that they paid and whatever. And the nurse practitioner thaws it out, draws it up in a syringe, and just starts injecting. He said they injected it in like 10 different places in my knee. What 10 places? Trigger point injections with allogeneic stem cells, so which are dead on arrival. If anybody tells you that they're going to thaw out your stem cells and inject them to you, like they're from a umbilical cord or something like that,
Sure.
They are dead on arrival. There's no cells in there. You're going to get a terrible inflammatory reaction from the dead cells they inject into you, and then when that inflammatory reaction comes down, your body has this ability to kind of shut it. Once it gets really bad, it shuts it down, and then you have no pain for a little while, and you think it works. And then you think it works because of the placebo effect. You just spent freaking $5,000 on something. It's gonna work.
It's gonna
because
fucking
it's
work
gonna
because
fucking
I
work.
I
spent
told you it's
$5,000
gonna
on
work.
it.
It's been
And you're gonna
five.
tell your buddy next door that you paid $5,000 for this and it worked.
How long does it how long does it work for? Like you said, short period of time. Month?
Mind. It's all the mind. Like when it comes to those allogeneic ones,
So then what is
the bone marrow aspirate
yeah.
concentrates do have good studies to support it. PRP, platelet-rich plasma,
which
we do, and the bone marrow aspirate concentrates do have good studies to support.
the
That
PRP
they are
is
better
big.
than cortisone, and they're better than hyaluronic acid injections, like the gel shots. Kind of
Sure,
stuff.
yeah. Are they healthier? Is there a healthier
you would
option?
say that when it comes to cortisone versus them, yes, I would say
That's
it's
what I mean,
healthier, for
but
sure.
for cortisone,
when it
'cause I
comes
know
to the
people-
hyaluronic acids, they're not damaging in any way, and they have a little bit of an anabolic effect. And
Yeah.
but the studies are getting
The
they're getting a
hyaluronic
little bit
acid, I
mixed.
heard people really dig. I heard people like them, but
Yeah, studies aren't so good right now, but I think there's a reason for that because insurance companies don't want to be paying for it. Our aging population, there's more and more people that need them. It's costing Medicare tons and tons of money. The
Oh,
more
no
studies
shit.
that they produce that say that it doesn't help, the more chances the insurance companies
little
won't have to pay
political
for-
there then,
won't
huh?
have to pay for it anymore, and then.
But I've heard good things about
Yeah,
those.
I have
I
mixed
know
results.
people that do a lot of cortisone shots as well. Cortisone's like that last resort thing. Am I right?
Yeah, I mean, if you know you're going to need a knee replacement at some point, you can do some cortisone here and there. The more there is a correlation between the more cortisone injections you get, the higher risk you are for getting a joint infection, like a
okay.
prosthetic joint infection. So the more and more you do, like you say, I'm going in every 2 months, and then you decide to have a joint replacement, you're going to have to wait some time. Usually you want to give it anywhere between 3 to 6 months if you've been doing them regularly for a while before you go and do that. So
boy.
you might want to switch to a PRP before you do your,
So that's what I mean. So the people, the PRP and the bone marrow aspirate concentrate. I don't know how to say
bone
it.
marrow aspirate concentrate.
It's just a quote unquote healthier option. And I mean, I know people with PRP that are like, they swear by it.
Yeah,
They love it. And then I've heard people say
people
like,
come in
it's
all the
not
time.
fucking for me because it's also very painful.
Yeah, you can get an inflammatory reaction there too, just a little bit, because you're turning on kind of this healing type of a response, and it's kind of turning on functions and stuff. So, yeah, it can be a little bit painful depending on the location.
But again, if you're already in pain,
Yeah,
that's why you're there.
right.
Man, so I mean that was pretty intense conversation.
Yeah,
I dig
so
it.
being safe,
it's-
all this stuff. So when it comes to, I guess we finish up on the labs for the most part. Yeah. So PSA, getting your PSA checked,
prostate.
prostate specific antigen, making sure you're not getting huge bumps in that. That can be from anything from just inflammation of the prostate to prostate cancer. So you have to look at
What would
the
be
whole
what
picture
would
there.
be a significant bump? Because isn't it around prostate around what?
You want it to be below 4 no matter what. I mean, once you start getting it above 4, you're really starting to wonder what's going on.
What would be a high jump? Like, because I think what is an average? 1.5?
No, I mean, being less than 1 even. I mean, it ranges, you know, so
It ranges on person specific.
it's very important that you look at it from where it's going because, you know, it's not the greatest indicator that you have cancer, that's for sure. I mean,
Okay.
there are some...
Can I ask what is the greatest indicator that you have cancer through blood work? Is there one
for prostate or anything?
just in general? Like, there's not really one. How would I've always had this question. I've never asked it.
Yeah.
Do you personally? I'm just going to ask it on the podcast here. How does someone know if they have cancer? Like, what would be a direct correlation?
I mean, some of the things. I mean, there's so many different types and so many different ways that they present.
Is it
so
presented
there's,
through
so there's
blood
blood
work?
dyscrasias, right? There's things where you're getting blood cancers, you know, marrow cancers, leukemias, lymphomas, and things like that. You know, you're going to look at your white blood cell count and stuff, but you have a higher risk of infection usually. Like, you're getting a lot of infections, a lot of sinus infections, a lot of UTIs, things like that. URIs and things like that. So you're getting anemic, like you fatigued. The biggest things for cancers in general are unexplained weight loss, like you're just losing weight, lack of appetite, and then loss of weight, and night sweats.
Really?
Pain at night, like pain in your joints or bones at night. Like, I should say your bones at night, not so much your joints, but like you're feeling like a bone pain at night. That could be bad. That could be like a metastasis or something like that. Those are what we call red flags, you know, like.
Well, I only ask because anytime Hannah has something going on, she immediately goes to
It's
Google.
not a tumor.
And I'm like,
That's when you say, this is what Dad says.
well,
it's
not a tumor. But those are things that I always had questions about because I don't fucking know, and I don't think the majority of the population knows either.
Yeah, I mean, I was home one time with for Christmas, and my brother-in-law was saying, you know, I've lost like 20 pounds, and
That's drastic.
I've had a ton of reflux, and I'm just not I don't think I'm eating well, and because of this reflux, he was so fixed on this reflux he was having. And I examined him real quick and did a little palpation up here, and you know, I found a lymphoma. You know, this is an area where if you get a lot of swelling up in this supraclavicular area, that those lymph nodes are ones that kind of, you know, so he had a big tumor in his chest that
Get
was
the
causing
fuck out of
reflux.
here! Holy fuck!
Yeah. Yeah, he's in remission. They got rid of it. So, but yeah, that can happen.
That's what I mean. That
So,
shit happens.
Yeah.
It happens.
You know.
Yep, that's life.
Yeah.
It's good to get checked.
Yeah.
No, man, this was a little intense. I'm excited. I felt like
Hope you guys learned something, and it wasn't too boring. We didn't lose anybody there, but
no. I think that's why it's important for everybody to have a good doctor. There's not many people like you out there, from what I could imagine. That you're quite the unique individual, but I could imagine that there are people out there like you in other areas that have the same passion for being a quality doctor, but being able to be like, hey, so I need some hormone work done, but I also tore my tricep, and my kid's ankle's fucked, and Hannah's wrist's fucked.
Well, how are you doing now that you said you're not doing roids, you're just doing HRT?
HRT. The fact that I feel as good as I do mentally is whenever you're geared out, you think like you're okay.
Oh yeah.
I don't think the same as I did.
Yeah, no, you're right. Yeah, you're like Superman.
You are fucking Superman.
Yeah.
And like you're like,
that's
cool.
the dangerous part of it. People they train, and they're training hard, and they're recovering faster and things like that, and they don't feel the joint pains and aches. They keep working through it, and then something pops because you just didn't feel it.
But also mentally.
Yeah,
like
your ego's running out of control. Your sex drive is running out of control. You get a woman standing next to you that's hot, and you're like benching. You're like, fuck, I'm gonna do this. You know,
it's crazy.
You're gonna do the ego press, we call it. You know.
Yeah.
That's what ruptures pecs. You know.
Oh, it's wild. But I loved it. That is my personality. I don't think it'll ever change. That's why I was attracted to it. It's just something that you grow into, you grow out of, you learn, you continue to evolve, and that's it.
So for those who don't know, this is being done at the time right before 4th of July.
Yeah, you came with gifts, and we got to go through it all real quick here with everything.
And I was going to, show you some things. Yeah. This is so you got your wall of
Bourbon.
Scotch and good things, and I'm kind of a cognac guy.
You're a cognac guy.
Yeah. So
Brought in Louis the 13th.
So I like Louis.
Yeah. Louis Vuitton.
Louis. My dog Louis. Hey, where's Louis? Louis, come here, buddy.
He found
the-
he found the mats.
Come here, bud. Come on to the radio show. Come on the show. Come on. You've been on the show before.
Louis 1, Louis
Hi,
2,
Seth.
Louis 3.
Hi, Seth. Nice to see you again. How have you been? Last time I saw you wearing a brace. Where's the brace?
I threw that bitch out.
That bitch? Oh, I like them bitches. Tell me about the bitch. Oh, man, I like to hump bitches.
That's it.
What?
Look at the teeth
that you
hanging
said,
out.
What?
The teeth's hanging out.
Hey, I gotta go to the dentist.
Oh,
What do
I
you think
love
of that?
it.
What do you think of that tooth? So then I call her tooth. See that? Well, I'm kind of short on words today. I got a big weekend ahead. Fireworks. You know what happens when fireworks come and dogs, like guys like me? We shake.
They lose
We
it.
shake. We get nervous. We hide in the closet.
Oh, yeah?
There's that banging. It's just not good. I don't know why you guys have this holiday. Why?
It's one fucking great nation, man. It's a great
'Cause
nation.
We're in a...
Yeah. It's a great nation.
It's our birthday. Okay. Enjoy it. Enjoy your fireworks.
Look at them.
Damn it, I hate them.
He's just looking at me. He's just staring like, all right. Nope, it's beautiful.
So Louis comes to the office.
With you a lot?
Yeah. He kind of sits under.
He's calm dog. Nobody would even know he's here. He's just hanging out.
So Louis. This is Louis. Come on. This is Louis the 13th cognac. It's great stuff. I'm telling you, this stuff is delicious. And I think that we should really partake a little bit,
I'm all
considering
for
the
it.
holiday.
Yes.
And so, as you know, it's quite expensive, so we use a little pipette.
Brought me a nice UPMC East highball glass here.
Yeah.
Very excited. I feel honored.
Hey, where are your other boys? Come on, they got to come try it. Where's your partner? I thought he was around.
Fuck him. Jay's gonna try it.
Come try some of this stuff. You gotta smell it. You gotta get that
That's delicious.
that throat there, and just get it in those sinuses.
It has oh man, my mouth's watering.
Ugh.
Do I have to
Come.
sit up?
I'll see if Bob's here.
Come on, we gotta get the crew over here. We gotta see if Bob's around.
The display is beautiful.
Well, some people just collect the bottles.
Oh yeah.
Yeah, there's a premium for those, man. Like people.
Oh fuck yeah.
We
We
wanna
got.
just
I
buy
mean
it.
that they said that the empty bottle of M up there. I think they said you can get like $1,500 for the bottle, and I'm like, kind of want to keep it.
Yeah, that's a nice.
We need to get another one for. We need to get another one for this holiday.
Yep.
Come out. But no, whenever you go to high-end restaurants, they typically have one of these. Like I know Eddie V's has
Yeah.
one, and it's probably this full still.
Yeah. Well, they usually charge like $300.
Oh, they'll charge. I think
glass.
it's 3 to 5.
3 to 5 anywhere you go. Yeah.
Brought some clean ones.
They had a fresh Macallan M Saturday night.
Oh
A
really?
fresh bottle at Eddie V's.
No shit. Man.
Yeah, we're gonna be going over to Capitol tomorrow, I think.
Oh, are you?
Yeah.
So we've been at Eddie V's quite a bit. That's our spot. But
Yeah, I like Eddie V's.
we went to a couple other spots. You're good, Jay. We went to a couple other spots. We went to Hyde Park, and I wasn't very happy with Hyde Park. I was a little disturbed with the service in comparison to Eddie V's. The food was pretty good, but then
Who else? Who else getting it? Anybody else?
I mean, I'll take one. Wait till you try it. It is going. I'm so excited. Bob's here. Bob's gonna try it and be like, where this would go good. It'd be a great one. Would be at my house.
Save every last drop of that. That's good.
Oh man. Man, it is It's fresh. Jay, do you want some?
Want some?
Just a taste.
Just a taste.
Okay, you can have a sip.
Sure.
You sure? Here, cheers. Thank you.
Gin time.
Bob's in there working on the net sweetest.
Oh, it's so smooth. Let's let it sit on your
Man.
throat for a little bit. It's like having like a bottle of wine sitting on the back of your throat.
There's no heat whatsoever. My tongue, the whole.
Could look good on the bar.
I remember last time he came over to the house and I gave
says-
him a glass and he just
I
slams it.
I just took the whole thing. I just tossed it back, and I'm like,
And I went.
he's like, oh my god. And I'm like, oh my god. My whole mouth went nuts, and I'm like, now I get it because you sip it. It's not you can't.
You
'cause
don't.
An ounce of that, a half an ounce, you take it and you're good, and like it's different. This, whenever I did that, the whole thing ate my whole mouth alive. Like I couldn't stop tasting it.
Like a hint of smoke. Like
Yep.
just a hint.
But it's sweet.
So many different flavors as you just
super
kind of
sweet.
keep it on the throat and in the nose. It's just.
This is after dinner, big time after dinner drink.
Oh yeah.
Good stove.
Man.
Am I going to convert you?
I'm gonna kind of say it. I think I want one for the house.
Yeah. So I'll get one.
Fuck it, let's all do one.
Well,
Oh. Ooh. It does have a little smoke. I can taste it on the first.
it's awesome, right?
Man,
Layers.
Layers and layers.
I'm a big fan.
Well,
I enjoy it. Oh.
you guys have meant so much to me, and you guys have done amazing things for my business as well. Enjoy this bottle with all of your clients and friends.
No.
No way.
Enjoy it.
Oh,
Yeah.
man.
Man, what a Friday.
Fucking A.
Yeah, cheers to
Doc.
that. Thanks, Doc.
Oh, dude, thank you.
Appreciate that.
Might have to get your own pipette though.
That's okay.
Yes. Oh, brother, thank you. That's exciting. I'm so excited. I love gifts. Oh, man.
We gotta teach Mike and Pat how to sip it though.
Pat's not going to be good at it. Pat's really bad. Oh, man. Delicious.
It's amazing,
Oh,
isn't
dude,
it?
thank you so much. That is wonderful.
So, for another fun thing for
Yeah,
the weekend.
gotta show the other gift here.
So,
Well, Doc is not only is he
this
all
one I
those
can't
things.
legally gift to you. Or anything.
Yeah, I know.
But
Thanks, Bob.
all right, hey, thanks, Bob. All right. So, yep.
So, Doc is also a firearms enthusiast. He is
Yes.
a hardcore American. It is
I-
a beautiful thing that you are. Man, your wife is such a lucky woman. Probably dicks down to your fucking middle of your knee, everything, the whole nine.
Yeah, no.
But
I can win a 3-legged race by myself. Yeah, right. So this is a Nighthawk Bob Marvell 1911 custom, 101, handmade by one gunsmith. You know, it's their way. Okay, of course you always do that to be sure. And this is a marvelous piece of work, very accurate. You know, when that's in battery, man.
anybody
thing
that knows
locks up really nice. It's got the dual
Nighthawks
slide.
are
Yeah,
absolutely stunning.
fantastic, super accurate, fun to shoot, no recoil. It's got this recoil spring that just is awesome. It's nice and weighted. But I got this over at Defender's Armory.
It's right up the road from us.
Yeah.
Defender's Armory is in
Is that Jeanette?
Jeanette. I
Yeah.
think it's right on the Greensburg-Jeanette
Yeah, right there
border.
on the border on Route 30.
They have. That's where I got my staccato.
Yeah, I brought that too. But yeah, we
yeah.
got that. Did you show that already?
No,
Yeah,
I didn't
so
show
this
it off.
staccato. So they kind of specialize at that shop on selling
Higher end pistols.
higher end pistols,
Higher
and
end
gun-
everything, really.
Yeah,
they
they
do.
do a great job at like fitting the right gun to you. You know, like They're not. You're not gonna walk. You go to a gun store, like some of the bigger ones, and you walk in, and they like treat you like you don't know. They treat you like you don't know anything. They speak over
Even
you.
if you
and all that
don't
kind of
know
stuff.
anything.
And when
it's
you
okay.
don't, and when you don't know anything, you go in there. They're gonna teach you. They taught me. I mean, I've shot guns all my life, but I didn't know a lot of things about 1911s and this and that. So I'm a huge 1911 fan. I love the.
So
way they feel.
I just like them. I just like everything.
But you're a Glock guy.
I am a Glock guy, but I have Staccato's my shit. A C2.
Pretty awesome. Yeah.
Man. Again, another phenomenal pistol. It has so many, from a hold standpoint and from a feel standpoint, very similar to the Glock for me. Just
Yeah.
it was an easy transition for me. Still love all my Glocks, but I can't shoot a fucking 1911 to save my life. I don't know.
I gotta go to the range with you and figure out what that's all about. Because this thing, you can't miss anything with that.
I don't know if it's a hand thing. It just doesn't feel right in my
And
hands.
the laser on that one, you can't miss anything either. So.
Fuck no, these are sick. I love this gun. This is not many. I haven't held anything that has been in comparison to the Glock for me, just for accuracy and just feeling comfortable with it. Maybe that's my thing. I just don't feel as comfortable with that in my hand because it's a little bigger of a grip. But this has been an easy transition for me. And right now, I just did all that work at my land or at my property. I just started moving stuff.
Yeah.
Well, I've been working on building a range where I just had all more land cleared.
Oh, yeah.
So I stacked it. I stacked all the trees right there, and I'm covering it with dirt.
Oh, good.
The dirt there.
Yeah,
So
cool.
now I'm going to have like little pistol range.
Oh, cool.
So that's one of my summer
get some
projects.
metal.
Yeah. So I'm
Start
going to Mike Shaw, who was on the podcast, the one he's a former cop. He is friends with I can't remember the company that he works with, but they do all kind of steel.
Oh, yeah.
So I'm going to have him come in, and we're going to build a range together, and he's going to.
Very cool.
So I'll call you up whenever we do that because it'll be good times.
We could make a field trip out to Defenders and pick up some nice stuff too.
Fuck yeah.
Yeah.
I love them.
Hey, I'm looking to get another Nighthawk. I want to get one other Agent 2.
So you also said that you showed me out there. I'm not big on trap shotguns. I don't know much about shotguns.
Oh yeah,
From
so
trap shooting
that's been
perspective.
my most recent kind of getting back into again because I was a kid when I shot with my grandpa. We used to go almost every weekend. We used to go trap shooting. Yeah, have the old arm. You'd load it up and
Yeah. I mean, I love.
You know.
I did it as a kid too, but not. You are into it, and you just showed me what you just purchased.
Yeah,
your
so
trap
you know, I get
shotgun.
into it. I get into
you
it, man.
splurged a little bit.
I
Now we
did.
were drinking Louis. We have a beautiful Nighthawk custom here.
and I
the
got
Staccato.
I got a nice
Now these-
Kohler combo shotgun.
And you have a Kohler shotgun out there that I'm like, I don't really know what it is.
The best of Kenosha.
Apparently,
Yeah, no,
it is a
it's
beautifully
amazing.
American-made shotgun.
It is an amazing shotgun. Yeah, it's so well balanced and just comfortable. It's a left-handed. It's got the recoil pad and all that kind of stuff.
It was sick.
It's pretty well fitted to me.
Gave me a
now.
little bit of a chubby when you were pulling it out there. I was like,
Yeah,
man,
it's
does
pretty
this look
sweet.
cool? It's just something you
Yeah.
show up and you're like, fuck. If you're really into it, it's awesome.
You know, there's one thing about blinking metal can be fun. Shooting paper nowadays to me is not so much fun, but having that moving target, the velocity and the randomness and all that kind of stuff is just it's a different experience with shooting. You know,
Sure. It's a lot of fun. It's
and
challenging.
fun. It is very challenging.
This is a perishable
Some people
skill.
make it look very easy, and it's not always.
No,
So, you know, I don't like the skeet as much because it's very mechanical. The
Sure.
trap I like because it's kind of more random, and it's then there's of course sporting clays.
Yeah.
And that can be
That's fun, too.
Yeah, I'd like to do that. a little
But
bit
no,
more.
this is, from my understanding, this is your shit right now. I see you doing it on Instagram. You post about it almost every
Yeah.
single weekend. This would be what your stress relief. Working so hard,
You gotta
doing all
have
your
it.
all
Yep.
your million
Yep.
fucking things that you're doing.
Yep.
And where you spend your money, it seems
There's
like you
just-
like guns and vehicles.
Yeah, well, yeah. I got one nice vehicle, well, a couple maybe, but you know, whatever. It's something where just you feel good doing it. My wife always was really hesitant to get into it, right? Like to even have a gun at the house. She's a psychiatrist. She's like, guns at the house? Fuck no. You know, so took her to the range. She shot that other guy. Oh, there it is behind you.
Another toy.
You know, it's another toy. It's a little 45 caliber. So put that magazine in. It just looks beautiful. So another one I got from Defenders. They always have some good used stuff.
They
and
do, because
this
I bought one there. I bought something similar
this is
as
a
well.
beautiful 45 caliber pistol with the pistol brace on it. Of course,
That's what they're
our
going after
government
right
wants
now.
us to turn this into something illegal. So everybody's got these pistol braces, all of a sudden going to be a felon, which is ridiculous. But this is a really nice, super accurate. I mean, that
It's
laser and
beautiful.
that red dot just.
This is just a fun gun.
It
It's
is.
great home defense. It being
Yeah,
a
my wife
45,
likes shooting it. My
yeah.
PA shot it. It's really nice.
Fuck yeah.
Yeah,
Fun shit.
it's fun. It's just fun, And shooting it against metals even is cool,
Anything that makes a noise off of metal is always fun.
Yeah. Especially clanging some weights, man.
Yeah. It's fun times.
Yeah, I don't do as much of the clanging weights anymore. Got to do the cardiovascular health thing, but
Yeah.
Big
Big on cardio. This is great.
well,
Man, what a way
nice.
to end a podcast.
Isn't it something? Oh, don't you have like a crazy question or something?
We could. We'll look one up real quick. We asked
Are we
as
running out
many.
of time here? Let's see here.
We're there.
We're good.
We're,
It's a long one
Doesn't
already.
fucking matter.
It doesn't matter.
Good times. All right.
I just want to hear one of them.
Let's see what we can find. They're stoner questions.
Oh.
Because it's called ducking high. It's fucking high. So
Ah.
it's if you were tuned up. Which Mario Kart character would be the best Uber driver? These are stoner questions.
Well, drink a little bit more of your cognac there.
If you started a podcast, what would it be about?
Hard-working motherfuckers. Anyway. Yeah, fun stuff.
No,
Well, enjoy your 4th of July, everybody. This is
Absolutely.
probably going to be after that, so you guys have already had your
You should
enjoyment.
definitely do the. You should tell everybody when they do something fucking stupid over 4th of July and when they hurt themselves.
Yeah,
come
blow
see
off a
me.
finger. Come see
Yeah,
me.
come see me. Jumping on a trampoline.
Jumping on a trampoline. I
Jumping
just
off
fixed
the
one of
roof
those yesterday,
and
actually.
Get the fuck out
Guy
of
went
here.
on a trampoline one time and he breaks his ankle.
Yep.
Yep.
Yeah. It's gonna happen.
It's going to happen.
Don't take
Call
the
Powell.
risk.
Prisk Orthopedics and Wellness, orthoandwellness.com.
That's it. That's it. Doc,
Sounds
this
like-
has been absolutely fucking wonderful. The display of everything, the gift, bro. I'm tickled pink, dude. Thank you so much.
Have a great one.
Everything. I appreciate it, dude. This is wonderful.
Always great
Thank
being
you.
All right.
And anybody, you need any kind of help if you are in the Pittsburgh area, even if you're not in the Pittsburgh area, and you blow something out, tricep, bicep, anything that you don't feel comfortable and you need to go see somebody, call Dr. Prisk.
Give me a ring.
We'll make sure that
I'll lead you in the right direction
all
if
your
I
stuff
can't
is
see
in
you.
the bio
Yeah,
of
no problem.
everything. We'll take care of everything. Doctor, thank you.
Awesome.
I love it, brother.
Thanks, buddy.
All right, everybody, have a good 4th of July. Do a good job. Fucking A.